Thanks, Millie. Good afternoon. Today I would like to go through the major points of interest with regard to the financial results for the Murrumbidgee LHD for the 2021-22 financial year. I'll also spend a little bit of time discussing the COVID-19 impacts on activity and finances. The MLHD is reporting a net surplus of 16.9 million, with revenues exceeding total expenses for the year. It is, however, important to note that the LHD was budgeted to exceed revenue by 21.8 million, and as such is reporting an unfavourable position of $4.7 million. The LHD reported expenditure of 781.9 million against a budget of 764.2 million, an unfavourable position of $17.7 million. The LHD continues to face a difficult financial environment, with this year's expense result being an improvement of 4.1 million on the prior year. Revenue favourability of 13 million was largely due to the LHD receiving higher than budgeted contributions from New South Wales Health. The LHD also undertook a revaluation of property, plant and equipment with a net increase of $106.5 million. The 2021-22 financial year has been an extremely challenging year, with the ongoing COVID-19 pandemic response impacting upon the financial position. The LHD continues to work closely with the Ministry of Health and other relevant stakeholders to improve the financial sustainability of the LHD. When comparing expenditure and revenues against last year, we can see that expenditure has increased by about $48 million, or 6.5% compared to the prior year. Adjusting for increases in COVID expenditure, the LHD's expenditure increased by about $30 million, or about 4.3%. Major factors included an increase in employee-related costs of approximately $27 million. Factors that impacted upon this increase include the direct COVID response, where our expenditure increased this year by about $10 million. Like many businesses worldwide, the LHD is having difficulty attracting suitably trained staff and is relying on premium labour costs to continue to provide clinical services across the Murrumbidgee. Overtime increased by about $3.6 million compared to the prior year. The LHD also accounted for a one-off COVID incentive payment for staff, and that accounted for a $10 million increase relevant to the prior year. Other expenses also increased by about $18 million this year. Approximately half of this increase was due to the COVID-19 pandemic response. Increases were also seen in capital expensing, $3.7 million, and health technology expenditure went up about $2.6 million. Depreciation also increased relative to prior years, with recent new capital builds now being depreciated. Revenues decreased slightly year on year, with recurrent allocations increasing by about 29 million, with an offsetting reduction in capital revenues compared to the prior year. The increases in the recurrent allocations from the Ministry of Health were as a result of the continued support for the pandemic, as well as an increase in the budget included in the 2021-22 financial year. The statement of financial position, or the balance sheet, is a statement of the LHD's assets and liabilities as at the 30th of June 2022. The LHD's net assets have increased by about 123 million. Receivables increased approximately $25 million this financial year. Prepayments have increased by $20 million and relates to prepayments made for capital works programs on our behalf by Health Infrastructure. Most of the increase in the non-current assets of the organisation is from the asset revaluation conducted during the year. Actual capital additions, however, totalled $46 million, with an offsetting depreciation charge of $35 million. Overall, current liabilities have increased $21 million on last year. Employee provisions have increased $15 million, with $10 million of this being related to the one-off COVID service recognition payment. Annual leave has also increased by about $2.5 million. Borrowings increased as a result of additional leases being recorded in the balance sheet in accordance with AASB 16. As everyone is aware, COVID-19 continued to have a significant impact on society during 2022. I would like to take a little bit of time now just to illustrate how COVID impacted on the activity of the LHD and also provide information as to how the LHD responded financially. The LHD spent approximately $50.3 million in response to the COVID-19 pandemic. This is an increase of about $17.2 million on the prior year spend. It is important to recognise that the LHD was extremely well supported by the Ministry of Health, who fully funded the LHD's response to the pandemic. The list that you can see shows the major areas of expenditure, with expenditure on clinical staff, pathology testing and protective equipment being the major expense categories. When discussing the impacts of COVID and performance this year, I will reference the 2019 financial year, as it was the year prior to the impacts of COVID, and as such serves as a baseline comparison. Bed day levels in the 2022 year were similar to the 2021 year, but were 3.5% down on pre-COVID 2019. You will see from this graph that the initial downturn in activity in April 2020, with activity normalising to some extent in February 2021. When looking at occupied bed days, we can see that Wagga Base Hospital and the renal services have continued to show growth compared to the 2019 year. Most other units, however, have shown a reduction in bed days across this time. Surgery levels have decreased 8.3% last year compared to the prior year, down 595 cases. With the 2021 year surgery levels including significant catch-up surgery to address the COVID impacts. Surgery levels were 2.5% lower than 2019. Due to the impact of COVID, the LHD had 487 overdue patients on the waitlist as at the end of 2022. The LHD has also seen an increase in the number of patients on the waitlist, with it increasing by a touch over 1,000 patients compared to the prior year. Emergency activity increased in 2021-22 by 4.6% compared to the prior year, but was 7.3% down on 2019. As you can see from the bottom right graph, the reductions in activity relative to 2019 have been most evident in triage categories 4 and 5. It is important to note that both of these categories increased in the last financial year. ED activity has remained reasonably consistent at Wagga Base Hospital, with only a small reduction of about 1%. Other sites have shown a larger reduction, with the regional facilities in the east of the LHD showing a 17% reduction relative to 2019. So overall, non-admitted activity has increased 11.9% compared to the prior year and has increased 3.5% compared to pre-COVID 2019. Adjusting for COVID, the LHD's non-admitted activity has decreased by about 5.5% compared to last year, but we are showing a small increase relative to the 2019 year. As you can see from the graph, activity has begun to normalise, and it is noticeable from period 8, February of this year, as COVID activity reduces. Virtual health or telehealth activity has increased during the pandemic. The LHD pivoted to virtual services quickly in the last quarter of the 2020 financial year, when the pandemic started, with activity staying high for most of 2022. We have seen, however, some reductions in the last 2 months of the 2022 financial year. Now, looking forward into the 2023 financial year, the LHD has received its formal 2022-23 service level agreement, which contains the budget allocation. The LHD's expense budget has increased by about $29 million, or 4.2%, to a total of $728 million. The own source revenue targets have increased by approximately 2.2% to a total of $107.7 million. Whilst the LHD continues to operate in an extremely challenging financial environment, With the current labour market presenting particularly significant pressures, the LHD continues to work towards financial sustainability whilst ensuring clinical services are continue to be provided to the communities of the Murrumbidgee LHD. As usual, the audited financial statements are available on our website. Thank you, and back to you, Millie.